Last year, we partnered with BJC to offer our community baby shower. In the Community Health Improvement Plan, one pillar is to reduce racial disparities as it relates to maternal child health, so reduce the morbidity and mortality rates. And the community baby shower specifically address the activity to connect families to wellness and resources. I'm proud of the team that this is something that we as a region highlighted as a priority. I think it speaks to our commitment to continue to show up for our communities, and to also our commitment to the region that we highlighted this as an important priority, and we are continuing to put action behind our words. The joy that's there, and people can hang on and hold on to that joy. So as a region, we can celebrate improving these outcomes together, and we can continue to connect moms and babies to resources they need so that everyone can strive. So we're able to provide connections to housing resources, utility assistance, getting pack and plays, getting actual tangible items that a mom would need.
As a new mom that currently isn't working, events like this is very important because the resources that are made available for me, myself, and my family is very necessary. It's going to impact myself and my child and my family in the long run. If someone is in a situation just like myself, they can use these resources as well.
I'm really passionate about advocating for maternal child health, and specifically Black maternal child health, is because I recently had a baby 16 months ago, so that experience is really real to me. I think for me, having a dual experience of I'm a birthing woman on one hand, but on the other hand, I showed up as a physician as well. I still remember when the nurse, looked at me and was like, "You are a patient, we'll take care of you, set your doctor hat aside." But even me, I showed up like, gotta make sure this is right, gotta make sure I do this right, gotta make sure I get my epidural this time. All in my mind that I was already trying to provide my own health care, and it was a reflection that maybe I didn't trust the healthcare system.
In that moment, like I said, it really felt like it was happening so quickly. Like, hey, maybe we need to try this. Okay, lessen the Pitocin because this is happening. And so I'm trying to process it in the moment, but it is hard to. And so it was just so awesome to have my doula and my husband. Sorry, shout out to him too. He did a great work as well. But it was just really awesome to have both of them though. And to her was like, she was telling the doctors, hey, she's in the bathroom right now. She's in the shower right now. She'll come out when she's ready. And just having that person who knows the system of like, yeah, we're on a time clock, but also we're going to respect and give her space to make these decisions and have time to allow the labor to progress. And so that was just so helpful, truly.
They checked me in and all of that good stuff, see how far along I was dilated. I was like probably 3 centimeters at the time, but then within 0.2 seconds, I'm telling the nurse like, hey, I gotta push. They was like, no, we just checked you. I was like, ma'am, I have to push. So she was like, no, that's impossible. So my doula, she was on my side, and she was like, do you mind if I was like, go ahead. She was like, no, baby, I see the head. You have to push right now. And unlike a natural thing where you have your baby on your back, I ended up having her on my side, and it was like the most amazingest, beautifulest thing ever. Just to be at home, get to the hospital in the ambulance, and then she out just like that. So.
Listen to our needs. Just listen. So I know me. I've been with myself 40 years. Just listen to me.
My advice, honestly, would be to listen. Please listen to the patient, the person that's there, the mother that's about to give birth. Just listen. That's it, that's all. Because 9 times out of 10, we know our body better than anybody.
If a woman is coming to you and they're saying that something's not right, oh, yeah, that's typical in pregnancy. It happens. Really listen to them, assess their situation, and just hear them out fully. And even if it is like, it sounds like an emotional response, give them that time and space and listen.
The To Be Heard initiative came about when Generate Health received the CDC Foundation Hear Her campaign grant. And the goal of that campaign is to make sure that community-based organizations are being engaged, to have community be informed about urgent maternal warning or pregnancy danger signs. To Be Heard was just a natural way to bring a spin of St. Louis voice onto what it means to hear the people that are not being heard when it comes to their health care and maternal child health. It's important that people begin to know what it looks like to recognize the pregnancy danger signs with pregnant people in their lives. Even in the, in the mental health arena, having thoughts of harming yourself or your baby. Those are signs that people around you need to be out on the lookout for so that they could possibly help save your life or the life of someone else that you care about. So it's our goal to help make sure, like we said, that Black families thrive before, during, and after pregnancy, because we know then it's gonna make a better way for all of us to have a life that we can be proud of.